This
Hey
call is
there.
being recorded.
Hi, how are you doing?
Good. How are you?
I'm good. Thank you for asking. Thank you for agreeing to do this with me on such short notice.
Yeah. No
All
problem. No
right.
problem. I meant to do the informed consent, but I will do that and get that back to you. But at least we're getting your questions done.
Okay. Yeah, I just have to I think we're turning in our interview like on Tuesday, so just whenever before
Yeah.
that is fine. Okay.
Okay. Sounds
Alrighty,
good.
well I will go ahead and get started. I just want
Perfect.
you at first just to like briefly explain like your background or your work expertise with like childhood trauma and like what you do.
So I'm a licensed marriage and family therapist and licensed professional counselor, mental health specialist. I've been in private practice for 11 years, and I treat a wide variety of issues. And over the last 11 years, my work has taken me into getting further training in things like EMDR therapy and just trauma work in general. So I don't specialize just in childhood trauma, but in trauma in general. But that has definitely been a topic or a focus for sure. A lot of folks have childhood trauma.
Okay. Sorry, I'm gonna put you on speaker. Okay, so how would you define trauma?
Trauma is, a loose definition would be any event or experience somebody goes through that they do not have the resources to handle, whether that's physically, emotionally, spiritually, relationally. And when that happens, the experience, an event is not processed the same way through the body and the brain that an experience that is less overwhelming would be processed.
Okay. Are there different types of trauma?
Yes.
Can you briefly explain a couple?
So obviously there's things like sexual trauma, where somebody is, their boundaries are violated or exploited. There is emotional trauma where you have somebody who is abused or exploited with their emotional boundaries. Gaslighting, that's where like somebody is sort of lied to or kind of told they're crazy, and then they over time believe in that lie or that sense of being crazy. There is physical trauma where somebody obviously is, physically affected. Their boundaries are violated physically, coerced or abused. What else? Physical. There's, I would say, we'll just go with that.
Okay. Alrighty. Are there some that are like worse than others?
I would say that it's not necessarily that trauma is, I don't like to compare trauma. Trauma just has different effects. For sure there is what we call small T trauma and large T trauma. Small T trauma might be like lots of little events, relational, less overt, smaller single episode, kind of like, let's say an example might be you get into a small car accident and you have some anxiety about driving going forward, versus like a large T trauma might be something like, you have catastrophic loss because of a huge event. So, a major divorce with a lot of loss, or losing a child, or, a kind of bigger episode with bigger ramifications and consequences.
Okay. So is there a measurement? I mean, how do psychologists measure like small and large T trauma?
That is a good question. I know that there are different skills for that. There's a lot of different resources out there. I don't do a lot of measuring of that. There is the ACEs, which is adverse childhood experiences, but that is for specifically childhood trauma. For small T and large T trauma, I don't really know if there is which is sort of a loose term that we use.
Okay. So what separates trauma from other other mental health issues like depression or anxiety?
So those are mood disorders, and they fall into the diagnostic categories that we have diagnostic criteria that sort of determine those diagnoses, and they're just specifically focused on symptomology, not experience.
Okay.
Trauma is more basis or systemic, and then I would say the diagnosis is kind of the expression of that traumatic experience.
Okay. All right. So are there physical or like emotional indicators or signs that a person might be suffering from past trauma?
Yeah. There are.
Okay. What are like some examples that would be like the most common for people to recognize as like a symptom of that?
Yeah. So let's see. I guess my brain works today. Come here. Sorry, I let my dog out. Come on. Let's go. There are things like disassociation, where someone has time loss, where they sort of check out and they don't, remember they've lost time, essentially. Like they don't, they might sit and stare off for a while, or, find themselves in unusual places. Disassociation. There's depression for sure, and anxiety could be from trauma as well. Specifically anxiety or panic attacks, sleep disturbance, relational issues, difficulty focusing or being present. See what else? Sort of a heightened hypervigilance, kind of being on all the time, difficulty relaxing, difficulty loss of interest in things that once brought you pleasure, isolating, not wanting to be around people. Those are some of the symptoms.
Okay. Are there like common phobias?
Yeah.
Are there like common events that usually cause this kind of trauma as a child? Like, what are some examples of something that
sexual abuse, lots of moving. Okay. Emotional abuse, physical abuse. Yeah.
Okay.
I'm sorry, come here.
Are there like common things that can trigger reactions from this trauma that you've had as an adult? Like, what are some things that can trigger it?
Life changes or transitions, like marriage. Come on, let's go. A job loss, any kind of loss, or stress. Like stress can really trigger that. I mean, that's generally what happens when you have a life change and you feel more stressed. Those are pretty common reasons.
Alrighty. What are some like methods to treat trauma, and what are like seen as like most effective based on like contemporary research?
EMDR therapy is probably the biggest one based on research. It's a form of hypnotherapy. You also have equine-assisted psychotherapy. There's growing research around that. Somatic experiencing. What else do we have? We have DBT therapy, which is good for sort of helping regulate the nervous system. So
what is like like you said, DBT, and
DBT, dialectical behavioral therapy.
okay. What is that?
It's a skills-based therapy that focuses on helping individuals build internal resourcing. And then EMDR therapy. Go ahead.
EMDR? Is that what you said?
Yep.
Okay.
That stands for eye movement desensitization and reprocessing, and it uses bilateral stimulation of the brain to work through traumatic memories.
Okay. Interesting. How many, on average, would you estimate experience life-altering trauma?
I think it's 2 and 3 people or something like that. It's some kind of crazy common statistic. I would say more people than not.
More people. Okay. So you say 2/3 of people?
Yeah.
Okay. Do you think how many of those actually realize that they do
have trauma?
Mhm.
I would say, I don't know, maybe it just really depends on the person, their resources. I don't know how to answer that for you, quite honestly.
Okay.
I don't know.
So, my next question is, how might trauma from your childhood affect your future relationships?
It will affect it. Definitely. It will definitely affect it. And how that might look could be that people may have intimacy issues, struggle with, trust and mood regulation. Yeah.
All right. Is there ways that parents and guardians can prevent their childhood from trauma, or do you think it's their parents' responsibility, or just seeking therapy at an early age or counseling kind of thing?
For sure, if there is known trauma, to have it treated, for sure. Parents also getting treatment to know how to be supportive. Yeah. And knowing that you may have to revisit it in the future. That's pretty common.
Mm-hmm. So maybe preventing the child from hearing their arguments or stuff like that.
Just learning how to be supportive and understanding what trauma healing is going to look like. So definitely learning how to listen for sure. But also, in providing a safe home environment, emotionally safe, as well as obviously physically, relationally safe home environment, to help that child continue to process.
Okay. And I know you've kind of already touched on this, but what are some short, and then what are some long-term effects of trauma?
Short term is going to be things like you're going to see checking out, you're going to see withdrawal in friendships, you're going to see you may see eating disorders, you may see self-harm. Long term, you're going to see things like maybe continuation of those issues, other addictions, relational issues, trouble functioning with job. Just to name a few.
Okay. Okay, and then what are some ways that people who know someone affected by trauma can help? What are some things that they should or shouldn't do or say around someone suffering with trauma?
So a lot of times people with trauma are going to just need help making sure they have the resources. Step one, do they have a safe home environment? Do they have enough food, shelter, basic Maslow hierarchy of needs? They're going to need supportive, safe relationships and community, and they're going to need understanding from people that they may not always respond emotionally to situations the same way somebody who hasn't had childhood trauma may. So they might have overreactions to things. And so just sort of being patient and understanding that that might be part of how they are dealing at the moment. Things to say and not to say. Don't want to do comparative sort of, responses. Like you don't want to say, well, if somebody brings up their trauma and they're talking about it, what you don't want to do is be quick to rush in with a story about somebody else's trauma. Like, so you don't want to compare suffering, or you don't want to tell them, just get over it because I know someone who went through something worse. You also don't want to, over talk it. You might want to ask them what they need or how you can be a support or help for them, but you don't want to just, practice listening, but also not necessarily try to fully change the subject, but at the same time, don't be overly inquisitive about all the details. And then I would say, what did I say? I said basic needs, support. Oh, yeah, and just, see if they need resources. Like, are they seeing a therapist? Are they feel supported and have access to the right medical help?
Okay. All right. So last question. What do you think is the most important thing for people to understand when it comes to trauma?
That it's highly, highly common, and that many people have been affected by trauma. It's not just for those. Some people might be more obvious with the effects, but a lot of people it's very common. And so when people are struggling with mental health issues, they're not defective and they're not incapable of healing. A lot of times those mental health issues are because of trauma. So we have to really destigmatize our idea around mental health issues and start realizing that, like, most people have trauma on some level.
Okay. Yeah. I guess, like, another thing I'm wondering throughout this interview is just, like, how good is, like, the success rate of, like, these methods that you've been talking about? Like, is it common for people to be, are you ever completely healed from it, or, like, is there a point?
People, yeah, definitely. People get significantly better, for sure, for sure. Effects, though, will maybe always be there on some level, but usually people learn how to take those effects of what they've gone through and are able to do something with that.
Okay.
Like,
all right,
write a book or start a nonprofit, or, they usually take the pain that they've been through and they do something good with it.
Good. Alrighty. Alrighty, well, that is all the questions I have for you.
Cool.
It took a lot less time than I thought.
Awesome.
But thank you so much for agreeing to this. You've been a really good help.
Good. I'm glad. Yeah, no problem.